monitor disease patterns. It also helps us to control outbreak prone diseases through notification systems, through disease counts, through email notification applications, and flagging disease threshold to prompt outbreak response. Another project also helped in developing a triangulation tool that pulls AEFI, that's adverse events following immunization, vaccination and immunization data from 3 different platforms that is hosted at the government of Nigerian agencies. And then this gives us effective real-time vaccination safety surveillance monitoring. And that database has over 23,000 AEFI reports that has been characterized for additional exploration. We also develop methodologies to harness huge program data on remnant samples for serologic surveillance for COVID-19. And in that, we have over 8,000 records of patient-level records. This tool, we use what we call the NDR, which is the National Data Repository, and the Lab Information Management System to triangulate data for this project. We also develop methodologies to define the burden of acute febrile pathogens to guide decision-making and policies for routine surveillance. And in this particular project, we have over 10,000 records for AFI, and that can be leveraged for additional exploration. So also in the institute, we have research and clinical laboratories that provide services for research and clinical services. And these are some of the labs that we have. We have a biorepository that has the sample processing, and we have also genomic laboratory, we have clinical pathology laboratories, we have vaccinology and immunology laboratories, we have chemistry and hematology, microbiology laboratories, and we also have molecular diagnostics. And as you can see, some few samples of some of the tools that we have in the laboratories. Now we have available expertise around lab for sample collection, sample processing, storage, and documentation. And then we also have a strong procurement team that supports the supplies of reagents. We also have sample shipment that aligns with the IATA shipping regulation of using cradles, boxes, and dry ice. We also have laboratory testing, safety laboratories, and specialized testing. And then in-house, we have our bioengineering team that takes care of the equipment and the calibrations. We also have the quality improvement and laboratory quality management teams that are accredited. We also have quality assurance team that also helps in the lab. Now for data science capacities, we have data science capacities and tools that we use. We have data science capacity for data management, for analytics, and for visualization. And as you can see, some of our data management tools are the National Medical Record System. We have also the National Data Repository. We use the REDCap. We use the District Health Information System. We use the DF Explorer for our data management activities. We also do some analytics, and we use Stata, SQL, R, and Python for our analytics. And we also do visualizations, and we use Excel, Power BI, and R-Shiny for those ones. So we have collaborative opportunities in IHV. And if you want to partner with us, we have these areas where we have high quality, multi-center, large data sets for research and analysis. We have capacity building in data science and health research. We collaborate with institutions that has a track record of impactful research and program implementation. We have opportunities for joint publication, grant funding, and capacity building. And we have, of course, a biorepository with extensive capacity for sample storage, processing, and analysis. And our collaborative model is actually tailored approaches to meet partners' research needs and goals. So we expect some gains for partnership. One of the things, some of the aims we hope to achieve with partnering with researchers is to ensure that we foster innovation and knowledge exchange in data science and health, accelerate the translation of research findings into policy and practice, and that we also strengthen health systems and improve health outcomes in Nigeria and in Africa at large. So as I conclude, I am making this call that we should join hands together and save lives by collaborating to strengthen health systems and influence public health policy and practice. We believe that we can be a great team. That is, together, each achieves more. And for further information about how to partner with us, you can check us out on www.ihvnigeria.org. We look forward to collaborating with you. Thank you for listening. And we acknowledge the contributions of these institutions, the International Research Center of Excellence, IHV itself, Inform Africa, and the DSI Africa for this opportunity. Thank you, and over.
Thank you, Nivartha. Great, excellent presentation, and I love your message about partnership at the end. May I ask you to add your email address to the chat in case anyone wants to follow up afterwards? And we'll if anyone in the audience, if you have questions specifically for Nivartha, please put them in the chat, and we'll come back to them after all the presentations. So now we'll move to our second presentation. Thank you, Nivartha. Now we'll move to our second presentation from Anna, and I think if you share your screen, it should bring down Nivartha's slides. And so now I'll hand the floor to Anna Winters from Akros. Please go ahead.
Great, thanks so much, Amit. Can you confirm that you can see my slides?
Yes, they are in the Chrome browser, I believe. Go ahead. Yeah.
Perfect. All right, very lovely to speak with all of you today. My name is Dr. Anna Winters. I'm the co-founder and CEO of Akros, and I'd like to share a little bit about what our organization does and how we would look forward to collaborating with many of you on the line today. So Akros, we are a multinational organization. You can think about Akros as bringing together the insights of data science to practice. So actually operationalizing data science in the everyday decisions that governments and their partners need to be making on a day-to-day basis. So I'll share a couple of examples of how we've done that in real time. A little bit more about us as an organization. We have operations or have had operations and projects in across 20 countries in Africa and a little bit of work in Southeast Asia as well. Some of the areas or the programmatic areas that we have worked within include malaria, water and sanitation, vaccination, neglected tropical disease. And so we have been in business for over 10 years, heading towards 15. And like I said earlier, we've really focused on the data side of the equation, partnering closely with ministries of health, particularly as they navigate how to use data science within their day-to-day operations. And this often looks like the use of simple to more advanced technologies in the data sphere. So one example was in this use case of what we call community-led total sanitation. And in this situation, the challenge was to increase sanitation while also reducing diarrheal disease. We worked with UNICEF as well as the Ministry of Health in Zambia to identify and build simple data reporting structures to assist in visualizing sanitation and sanitation access, and then to equip chiefs, local traditional leaders, and change agents to monitor those data and to act to support communities and villages to build latrines, to utilize those latrines, and then to monitor uptake of sanitation as well as reduction in diarrheal disease. Those are a couple of the publications that came out of this work. So in this case, it was a simple use of technology. You can see this picture here on the right, where a local chief was partnering with one of our staff, Lenga, as she showed him how to utilize these dashboards on mobile phones to capture information, to visualize those data on a real-time basis. Another example of a challenge that we've aimed to support is reaching last mile situations with health services. And I know we all work in situations that often look like this from the air, where there's vast land and very rural populations. And it's a challenge to identify where are people living and how do we ensure that we're getting health services to those individuals? How do we target these health services to those most in need? In this case, a lot of the work that we have done has been within the use of geospatial data, that is using satellite imagery to map populations, understand spatial risk of disease, and to support countries to plan health campaigns and deploy those campaigns to last mile. And where some of the data science intersects this operationalizing of these data is bringing spatial risk models to bear in the actual planning and delivery of these health campaigns. This is one way that we have supported that trajectory, again, of bringing data science to the ground and operationalizing and everyday support to government practitioners. Across has built an open source tool called Reveal. This tool supports the planning, the guiding, and the tracking delivery of health services to the last mile. You can see Reveal's basically broken into 3 different steps, where on the left-hand side, we're bringing in various spatial risk models, as well as maps of houses and communities to understand, again, where are people living. In that middle square, you can see after planning where health services will go to reach those last mile populations, we're equipping teams with mobile technology to navigate to those houses, to those communities, and track and monitor that services were actually delivered to those households. And there on the right-hand side, you can see some of the dashboards that are inherent to the Reveal platform. So this has been quite successful work in terms of visualizing information, getting services to the last mile, and increasing the impact of health services. We've been working closely with IHVN under NIH Inform, where we've utilized the Reveal platform to support the visualization of COVID and HIV data, as well as building and then operationalizing risk models. This is something that we're in process with IHVN and partners in Nigeria and South Africa. What we've seen when we start to bring data science to bear on everyday decisions, as in some of this workflow through Reveal, is we're increasing health campaign coverage to significant amounts. We're seeing resultant reduction in disease burden. In this case, and some of the papers are linked below, we've seen a reduced malaria incidence of 15% when using Reveal to support the planning and delivery of indoor residual spray, or IRS in this case. We've seen a reduced cost per case averted. So this ROI is also significant. So I bring these points up just to bring to bear, or bring to mind, that when we can take a data science and the power of some of the spatial models that are being built in academia, that Across has also built, as well as other partners, when we can bring these and bring them into everyday workflows of planning and delivery of health services, that's when we start to see real health impact. We're bringing academia and everyday decision-making together in this type of platform. Heading towards close here, we've got some new and exciting questions that we're looking at now, and some of that with partners under the DSI Africa. First of all, we are just rolling out the project called Geo-Enabled Detect and Response System for Anti-Malarial Resistance in Ghana. We're working with IHVN as well as WACBIB and funded by NIH, where we're looking at, can we combine geospatial mapping with genomics data to better equip routine surveillance systems? Can we use that genomic data visualize it in a geospatial context in order to target our engagement on the ground and better understand areas of antimalarial resistance so we can plan appropriate intervention. So this is one area that we're looking into and moving forward in. The second is bringing in the power of geospatial and climatic risk models and bringing that to the hands of local practitioners. We're envisioning working with several different partners, Mathematica, as well as Conservation X Labs, to build this end-to-end pipeline of spatial modeling, bringing in that climactic piece, all the way to operations and driving these type of interventions in a very targeted geospatial approach. So in terms of what ACROS can offer, like I said earlier, we're really looking to bridge the gap between data science and on-the-ground decision-making that our government partners need to be making. We do that in a number of different ways, data visualization, simple data collection, and visualization tools to the more advanced geospatial approaches that you've seen here. We are also very open and do quite a bit of in-country training and partnership. And what we look to gain and what we look to build in partnership is some of what you've seen here, and that is cross-sectoral thinking and approaches where we're bringing in genomics and geospatial information into the surveillance space. With that, just a little bit of information on how to contact myself. Thank you so much, and looking forward to connecting further.
Thank you so much, Anna. That was a great presentation, really interesting work that in a lot of different spaces. I'd ask you also, if you don't mind putting your email into the chat so people can follow up afterwards. And if anyone in the audience has a burning question, feel free to use the chat. We have one more presentation from Timothy. Timothy, could we try your audio also to make sure that's working? And you can go ahead and share your slides as well. Timothy, could you just say something to test the audio? I'm not able to hear you, Timothy. So we'll give Timothy a moment to get, hopefully get the audio working on his end. While we're waiting, I wonder if we can take one or two questions from the chat. So Nifartha, was a question for you about whether your institute also works with across ecosystems like plants, for instance, or is it really focused on humans? The question's from Kehinde Oyeniran. Nifartha, could you answer that?
Thank you, Amit. So we work with viruses. I have some of my colleagues here who will also, interject and answer if I am not able to answer some of the questions. So I work from the data end of things, but I know that we work with viruses in humans majorly, but we are open to expand to any area such as working with viruses on animals or plants as well. Thank you.
Great.
I hope I've been able to answer the question well.
Yes, thank you. I know we have some more questions, but Timothy, can we try one more time? You don't need to use your video if it helps, but could you test your audio? Sometimes if you go to the microphone and use the arrow and adjust some of the audio settings, that might help. You can check to make sure your computer is using the same microphone you think it is, or if it's set to a different microphone. Okay, well, I'm still not able to hear Timothy, so why don't we move to more questions, and hopefully, Timothy, just please put a message in the chat if you're able to to get this working again. I hope we're able to hear from you. The next question, actually several questions came from Oleinka. And Oleinka, if I may ask you, would you mind just unmuting yourself and maybe picking one or two questions to start with? Well, maybe I'll verbalize. Olenka, if you're there, you're welcome to unmute yourself, but
Oh,
oh,
okay.
go ahead. Go ahead.
Did you say I should call out my questions, right?
Oh, feel free to, yeah, you can just speak
Oh,
about one of your questions now. I think we have
all
some
right.
time.
Yeah. One of my questions is based on the data sets she talked about. And like, I think I had her talking about, people interested in their data sets, partnering with them. And I was like, it will be good to know specific data sets that they have so that it will be easy to know if it is something that would come in and work with those data sets.
Okay, thank you. Nifartha, or would one of your colleagues like to answer the question about data sets that are available?
Okay, so in my presentation, I mentioned about 2 or 3. We have data sets for the AEFI, that's and also for the AEFI as well, that's adverse events following immunization. Now, some of those data sets might not be readily available in the public domain, but you can actually reach us if you require any data sets, and we'll be able to let you know this particular data set is something we can share or not, or you also follow the processes of acquiring those data sets, especially if you're using it for research. And then some of the data sets as well, we supported the government of Nigeria to get those data sets. We will refer you if we have no right to give out those data sets to the appropriate quota that will make it available for you. Thank you. I hope I've been able to answer your question. And my colleagues are here. They can also jump in to give additional perspective to the questions.
Yeah, thank you. Thank you,
Okay,
Nifartha. Oh, go ahead.
Hi, Amit. Hi, everyone. Just to add to what Nifartha mentioned, so IHVN, we've been part also. So we've had grants under the H3 Africa Consortium, and over there, for those that have been part of that consortium, we have a component where we have samples in the biorepositories. So we have 3 on the continent in Africa, and one of them, whose PI is Professor Bimiku, it's actually at the Institute of Human Virology, the IHVN campus in Abuja. So if you need some details about that to access samples and some minimum database attached to those samples for further research, that's also open, and that's an opportunity under the consortium policies. Thank you.
Yeah, thank you, Sophia. That was helpful. Let me ask again, Timothy, have you had any luck on improving your connection, your audio? I hear Kenneth, but Timothy, are you still there with us? Are you able to share your audio or your presentation with us? Okay, I see Timothy. Timothy sends his apologies for the inconvenience. Timothy, just let us know if you're able to improve your connection at all, and we'd be happy to give you the floor again. But in the meantime, maybe we can take a few more questions. And I noticed that there were a couple of questions that came in from Oleinka about partnering, specifically around partnering with newer, younger, up-and-coming universities and institutions, and kind of how those external partnerships form, what are the procedures. I wonder if Nifartha could answer that, but also Anna, if you could also answer the same question on behalf of ACROS. I think we might be interested to hear from you both. So maybe Nifartha, would you like to speak to that question about partnering with new and younger institutions and how that looks?
Okay, so we have no restrictions with the kind of institutions we partner with as long as they are working in the field we are working in. So the fact that they are younger institution does not mean that they are screened out from partnering with us. just reach out to us. We have I have mentioned our website, and I have dropped some emails. You can reach out to us, and then we pick it up from there. Thank you.
Yeah, thank you. Anna, go ahead.
Sure. I would also say that we're very open to partnering with newer, smaller organizations. We're also very open to partnering with new governments and their stakeholders. So, like I was saying earlier, we really look to bring the academic piece, say some spatial modeling or specific data science, to bear on the type of programming at government level. Maybe they're planning a specific mass drug administration campaign or vaccination campaign, and they want geospatial tools and spatial models to help guide the targeting of those campaigns, for example. So lots of opportunities. You can get in touch directly with me. We are often very keen on co-writing grants with individuals. And would be very, very open to learning from all of you and thinking about how we can use geospatial and data science in other areas. Thank you.
Yes, thank you, Anna. Timothy says he's trying to reconnect on a different device. We may actually, unfortunately, run out of time because we only have about 7 minutes left for our session. So Timothy, if you're not able to work, we'd be happy to put your slides on the website and find another way for the audience to get connected. But at this time, I think we have more time for questions. So I invite everyone, you're welcome to turn on your camera or raise your hand or use the chat. I'm hoping we can get at least a few more questions to the panelists before we conclude. Oh, Olenka, please go ahead.
All right, thank you. Just this going to ask Sophia. She did talk about the biorespiratory that they have. I just want to be clear, like, do we need to contact them to know the type of the biological samples stored up, or there is like a specific information somewhere on their website that we can get this? And if it is that we need to reach out to the organization, which department do we need to write to specifically?
Okay, thank you. Should I go ahead?
Please go ahead.
Okay, thank you, Lalinka. So yes, sure, please reach out. I just put in the chat that you can reach out through our research arm, which is at ISA-HVN. So please save that website. On the website, you will find that we have details of how to reach out to us. We have a specific email that you can shoot an email. You also have Nifarta's email there, so you can always CC her. Yeah, and I can also drop my email. Yeah, for those requests, you can CC us. So, and then we take it off from there. Thank you.
Thank you, Sophia. And thank you, Olenka, for a good question. Would anyone else like to raise their hand and ask a question to the group, to the speakers? Yes, Olenka, please go ahead.
All right, yeah, so this goes to Hapro. Well, I don't know so much about geospatial, but I do know that sometimes we do try to, when we work on some project, we do try to collect geolocation data. I want to know if this is the same as geospatial, and when you collect, geolocation data or information, like what other application can we really, use it for? Because I do know that I've worked with someone and they were kind of particular about collecting location information here.
Sure. I think collecting GPS data when you're running sampling is a first step. When we're attributing a geolocation to, say, samples, we can then start bringing in other information, for example, land use types or environmental covariates that may have an impact on malaria risk, for example. And with that, those sort of environmental information that we can glean out of satellite imagery, plus information about disease surveillance, we can put these things together and we can build a spatial risk model. And once we've built that spatial risk model, we have the opportunity to use that when planning responsive health services. So for example, in the malaria use case, a targeted approach to deploy malaria bed nets or mass drug administration. And this is often the challenge of our government partners is there's so much health concern, but not enough funding for enough bed nets or enough indoor residual spray. So we need to be smart about how to prioritize and target those areas. So when we start bringing those geospatial and GPS information together with data science and building these models, we can then provide the tools to those practitioners on the ground to plan and target health interventions smartly. And this doesn't happen just in malaria. We can think about with COVID, cholera, HIV. So there's really a lot of power when we can bring these pieces together in a pipeline.
Yeah, thank you, Anna, and thank you, Olenka. That's a great question. We just have a few minutes left. Timothy, are you there? How's your audio worked out? If not, happy to take one or two more questions. Would anyone like to raise their hand? I see Olenka, but hold for 1 second. Let me just see if anyone else has a question to give someone else an opportunity. Is there anyone else who has a question? You can unmute yourself, or you can raise your hand, or you can use the chat. Okay, Olenka, back, go over to you again. Go ahead.
Sorry for that. I've got too many questions.
That's okay.
So this goes to the Institute of Human Virology again. They also talk about, I don't know if I had right capacity training for data sciences. I'm interested in if it is possible that they do take on, students from universities who could do some kind of, because we do have a program that we call student internship, SciWest internship. I don't know if it is something they do take students. We could direct our students to have this kind of exposure to training on data science and also your data management practices. Yeah, thank you.
Yes, Olayinka, thank you for that question. So we have opportunities for interns to come into the organization to do their internship, but I think we have a structured way of doing it. So you can reach out to us and then we can pick it up from there. There are some criteria that you have to meet, and those criteria can be, you will get to know them when you reach out. Thank you.
Yeah, thank you. And I don't know, Anna, if you had any thoughts on internships or even any other capacity building types of activities that you're running at Akros?
Sure. We're actually looking to roll out some capacity building around Reveal within NIH Inform this year. And so you can be looking out even at the meeting in November. We're looking to host some trainings around the utilization of that platform and share what that's looking like in terms of data visualization of co-infections of SARS and HIV. So it could be an interesting time, and we'll be sharing that information out across DSI over the next couple of months.
All right, thank you. And just a note for everyone here that the DSI Africa program does have several training projects that have a variety of different activities. So many of those get advertised in the DSI Africa newsletter or on the website. So that's another place to look for things like short-term training programs, webinars, as well as longer-term opportunities, degree programs, etc. I think we are now at our time. So we're gonna, even though the clock shows a little bit longer, we're calling everyone back into the plenary. So I believe that we'll be closing all these rooms. You can use the leave room button at the bottom. and we'll get moving into another round of networking. So first of all, let me just say thank you, Anna. Thank you, Nifartha. And I'm so sorry, Timothy, that we weren't able to get your presentation to work. And thank you everyone for attending. I hope you enjoy the rest of the program.
Thanks very much, Mitt. Bye-bye.
Thank you.